last week.
Yeah.
Lex, you did a deep dive into the Freedom of Information data that was secured by Lee Turner. And it's pretty damning what you've discovered about, particularly what Bonnie Henry knew and when she knew it. It's a pretty long document you've put together, but maybe you could just give us the highlights, Lex.
Wow. So big. It's such a long thing that I did. I just like got, into it and off I went. I have a little summary somewhere that I'm gonna use to um so for anybody who didn't read the article, it's quite long. It's more than 30 pages. I don't blame you for not reading it. It's a lot of time. Um so there's this FOIA request. It's got more than 1,300 pages on AEFI's adverse effects following immunization. And that came out in June 2024. And then I looked into it at the time, and I quickly found, well, the first thing is that the BCCDC, which is in charge of monitoring those adverse effects, they have like internal, they have like non-public facing and public facing AFI reports. And the big difference between the two is, of course, it's like the public facing, they convey that there's not everything is fine and AFIs do occur, but like they're so rare, they're so very rare that this is safe and effective. But then like the non-public AFI reports that they were using to manage, the rollout, well, these things were telling like a complete different story. And the big difference in serious rates of of AFIs is the definition. So the BCCDC, when they felt the pressure to start releasing something to the public to that topic, they gamed the definition. And by changing their definition, by making it very narrow, then they excluded about like 75% of AFI reports from the number. So that's fraud right there. Um, the same the same trick was also employed by the US CDC in another slide deck that I have. So it's not like this particular fraud is not unique to British Columbia. Um, Key points here is, well, on March 15th, 2021, at the beginning of the Vax rollout, um, in the morning of that day, Bonnie Henry, she received like the most up-to-date AEFI report, the non-public version of it. And then in the afternoon, she went to give a press conference. And in that press conference, she made like several statements. I picked like 20 statements, and then I contrasted those statements with the data that she had, right? And shows that, well, whatever she's saying to the public is contradicted by the data that she has. So this is what the post is mostly about. Um, and on top of that, I am of the opinion that Bonnie Henry did not even believe what she was saying, obviously. Like, she knew that she was deceiving the public. And I isolated like several statements to that effect. That's just like, this person doesn't believe what she's saying. Um, if I can start throwing some numbers here, um, let me find some numbers that could wake up a few people if some are still awake, asleep. The shots mostly affected women. That's very, very important. So right from the beginning of the Vax rollout, uh, women experience about like 75%, 76% of adverse effects. So it's not that they were like equally distributed between men and women. It was mostly women by far. That's what the BC CDC data showed, and also what this US CDC data showed. Like they show like the exact same thing, like very close to 1%, like 76, 77% of AEFIs were to women. That's very important. The AEFI data that was released in that FOIA request, it shows total AEFI rates per dose, per vaccine lot, actually, and also like serious AEFI rates per vaccine lot. So these are two kinds of rates. So AEFIs can, based on the definition, they can be divided into categories, whether it's serious or non-serious, right?
Previous page.
And where am I going with this? Well, we're going to compare it with the flu, the baseline that the BC CDC was using as a safety benchmark. They were using the historic flu rate of AEFI. So for example, the flu shot, the total AEFI rate of the flu shot historically was 6 per 100,000 dose, approximately 6. And then the serious AEFI rates of the flu shot historically was 1.5 per 100,000 dose. With the COVID vaccine, when you look at the corresponding AEFI rates, we see like something like sometimes we will see a vaccine lot that has like 80 times more risk than the flu shot. Sometimes it's 15 times more. So for example, the Moderna lot that Charles Off, Dr. Off, everybody knows Dr. Off now. And Dr. Off at the beginning of 2021, he filed like 11 AEFI reports. And 10 of these 11 reports were for one particular Moderna lot, the same lot. And that lot at like a rate of, as of September 15, 2021, it had a rate of like 416 total AEFIs per 100,000 doses compared to the flu, which is 6. Right? So it was like 63 times more toxic. And we all know what they did to Dr. Off. So that's to give an example of the response to people who stood up. I mean, it's the same thing that they did with Detective Drew, different domain, but you have like someone who stands up and then they do whatever they can to these good people. So I covered like the change of definitions between public and non-public AEFI reports. I'll find something else that is
I
important.
mean, I think the critical piece is that you are able to definitively confirm what Bonnie Henry knew and when
absolutely.
she knew it, based upon correspondence emails that were received through a Freedom of Information request.
Yeah. Yes.
And then you contrast that with what her public statements were at the same time.
Yes.
And it's irrefutable, based upon the very detailed documentation that you've done, is that Bonnie Henry and others within the CDC in decision-making body, and again, not just in BC, because I believe that you show correspondence with the federal government, with larger groups of people. They knew what the risk profile was of these vaccines, and they intentionally, consciously lied to the public. They delivered false information. Right?
Yes. One aspect that's obvious, like you don't need to be a scientist, is if you see like as of March 15th, 2021, like beginning of the rollout, when she goes on our press conference, at that time in British Columbia, we have like 14 different vaccine lots between Pfizer and Moderna that have been distributed and they are being monitored. And the snapshot, what is obvious is that the AFI rates across these 14 lots is highly variable. I mean, that in and of itself would tell anyone like, hey, there's a problem with the manufacturing of this product. When you take an aspirin or Tylenol, I mean, you expect the same effect, whether you have like one lot number or another lot number, like the product is stable. That one was not stable. It was obvious just by looking at the AFI rates. So so AFI lot variability is a massive red flag that they didn't talk about. Well, I mean, she covered it up actually. If we look at the statements that she made, and it's because I don't have much time and I'm not too organized to do this, but one thing that I've noted when I look at the data, the non-public EFI data as of September 15th, 2021, that's 6 months later after our press conference. And the data shows like the number of AFI, the absolute number of AFIs reported per lot, and it also shows like a rate per 100,000. So using these two numbers, then you can calculate the number of doses that were distributed per lot at a point in time. So I can infer that, like it's not in the report, but it's simple mathematics. You can work out how many doses of a particular lot was distributed at a certain point in time. And what this is showing is that in September 2021, the most harmful lots had the least amount of doses distributed. So it shows that as soon as the BC CDC realized that, hey, one particular lot is getting a little bit too dangerous, they curtail the distribution of it. Well, that's knowledge of harm, and they're acting upon it. So
Yes.
I talk about this like in part two of
Well, and the other piece of information that I recall, Lex, is that when you made Freedom of Information requests, you discovered that with a lot that had very few adverse events, the number of emails that would be referencing that lot would be a handful, whereas there were some lots that was like what 7,000 emails or something that would suggest that there was a lot of conversation.
Yeah, behind this is I was somewhat like involved in the defense of Charles Off, Dr. Off, and I filed like a bunch of FOIA requests. And one day, Lee had an idea. It says like, hey, why don't you pick like the most toxic lots and try to FOIA the communications of these toxic lots? And I thought like, this is a great idea. So I filed FOIA requests with like all the health authorities except Northern Health. And they all like resisted those FOIA requests. And I appealed at the privacy commissioner and we lost against two health authorities on FOIAing communications that are particular to highly toxic lots. But in the process of doing that, there's one particular health authority that they were saying like, well, Lex, if we try to like extract like all emails that matches like a particular number, then it will overwhelm our systems. We don't have the capability to do this. So what I did is that I replied to this and I wrote them like a very long technical procedure using like the specifications of Microsoft. And I said, well, no, this is the exact procedure on how you extract those emails. And then a couple of them like shut up and said, okay, fine, we'll go ahead with it. So one health authority followed the procedure I gave, and then they replied like, well, like we we sampled our mail server using your method on the first two numbers that you gave us, like vaccine loss. And we found like 17 matching items and with the first one, and like 7,000 matching items with the other item, which is like another toxic loss. And these two lots that they try to extract like the number of emails, they were the least distributed lots. So they had like about like 20,000 doses distributed. So then you ask yourself like, okay, well, this health authority tried to extract all emails matching one particular toxic lot, COVID vaccine, and they isolated 17,000 communication emails for something that was distributed to 20,000 people. So what could possibly trigger so much communication on something that is supposed to be safe?
So I mean, let's summarize here, Lex. So the bottom line is there's compelling evidence that they had
Yes.
knowledge of harm and they ignored the harm.
Yeah.
They lied to the public. And this is evidence that, if we, getting back to Vincent's conversation, if we had a legitimate law enforcement in this country, this should have been an investigation into criminal behavior. And we're
Well,
not going to give up on that because I think that that's where we need to go. If this country is going to get back into a solid foundation, these crimes have to be investigated and people held to account. And to me, you have provided an incredible amount of data for the police, law enforcement, that if we had a system with any integrity would have you sit down with them and go through all of the data that you've discovered.
well, yeah, what's important is like the statements, the public statements that Bonnie Henry made on March 15th, 2021 are contradicted by the data that she had. Very much contradicted. And also during that conference, I think it's important, she tacitly admitted that they were harmful. Like that's an inference I make. And I'd like to talk about it. I have to find a statement here. She make a statement. She says like these reactions are not uncommon, and we continue to monitor our distribution to make sure there is not more associated with a single lot or not, right? So there's two important elements in that sentence. Is like these reactions are not uncommon, and then we monitor the distribution. So the distribution aspect, I talked about it. I said like, look, the most toxic lots were the least distributed. Therefore, there was most likely an awareness that these things were harmful and they were like curtailing distribution. So, but then like the first point is like these reactions are not uncommon. So if we refer to the documentation of NACI, which is National Advisory Committee on Immunization, this is something Bonnie Henry, like as an expert, is very familiar with. They have like five categories of AEFI frequency rates. There's very rare, uncommon, common, and very common. 5 categories of frequencies. Very common means that like an adverse effect occurs like in more than 10%. Common means it occurs between 1 to 10%. Uncommon means that it occurs between 0.1% and 1%. Rare means like 0.01% to 0.1%, and very rare, less than 0.01%. So when Bonnie Henry says the reactions are not uncommon, well, we know by the rates from the BC CDC that the reactions are definitely not very rare. They're definitely not rare. And now Bonnie Henry says they are not uncommon. That means that in her mind, the reactions are either common or very common, which means the reactions occur in at least 1% of the recipients, right? And once you get to that level, then you have the medical calculus of bringing more fewer harms than benefits, and then automatically, she recommended something that is by the numbers more harmful than the benefits of the or
Yeah.
well, the alternative is the illness itself. So the cure, the cure is more harmful than the disease. That's what it comes down to. So
So again, the evidence is there. It
yeah, it
requires,
goes into the medical ethics. So
yeah,
by saying like the reactions are not uncommon, it implies that she knows that the reactions are at least common. And as soon as we've got that, then she recommended something that was like way more harmful than the disease itself, and she
yeah,
breached medical ethics.
she needs to go to jail.
Right.
We got a couple of hands here and then we need to move on. Barbara?
Good morning. Thank you for this work, Lex. You were mentioning a report at the beginning. Is this report referring to all of this data that you've been accumulating and your findings, or
What can you
you
can you
mentioned
mention
that
like
you
what's
mentioned
the name of the report or what?
I don't know, you said you were talking about a 30-page article. So is that
Oh
the
well, no, I was just saying like my Substack, the last one I wrote is about like more than 30 pages. That's what I was saying.
okay, is it about specifically this information that you're talking
Yes.
about
Yeah,
today?
what I'm talking. Yeah, exactly. So if you want like
Yeah,
the full story.
so the link is in the agenda that I sent around yesterday to
Okay.
Lex's Substack. And he's
Okay.
actually written a couple of very long reports on this very topic. And I think the more that people are aware of the conscious criminal behavior,
Yes.
the more likely we're going to get some action on that.
Yes. Yes.
Sarah?
Thank you very much for your work on this, Lex.
Sarah?
If you want to have some fun, what I recommend the audience is, but it will cost you some time, is like read the post, and in one screen, open a browser and listen to what Bonnie Henry is saying. So in my post, I isolated various statements with a timestamp. So you don't even have to listen to the whole press conference of Bonnie Henry. You can simply like go to the exact timestamps where she says like X, Y, Z. And then you can read my commentary and analysis with respect to that statement. And that's fun actually.
Well, that's how
But
you see.
it requires time. I mean, for now, like all you have like is a headline, like and then you move on to the next topic. But if you want to make an effort, it's worth reading if you're interested in the topic.
Thank you.
Sarah? Can you get yourself unmuted, Sarah?
Sorry about that. I couldn't get myself unmuted. All I had was a question. So one of the things that I'm finding is a consistent problem is we gather all this evidence, and yet we have a corrupt court system. We don't have a justice system. Is there anything that you can do with this information to hold this horrible, evil person accountable?
Well,
Because my frustration is, you get all this information, it's proven, it's proof, we know this woman is a mass murderer. Now what?
well, I want to say that the reason why the system is, that's my opinion, the reason why the system is fighting so hard against Dr. Off, against Helen Grew, and the likes, it's because the liabilities are crippling. That's it. I mean, it's just like crippling. It would the only remedy to what we went through over the last few years is a complete obliteration of the bureaucracy. That's it. You cannot like give like a check to everybody who was injured, like a check of like $100,000 for whatever reason, injuries or whatever. It would cripple the country, every government. Right?
Yeah, but I'm not
so
talking about money, Lex. What I'm asking is like, even just getting these people put in jail, hung, whatever, some kind of consequence for their action. My frustration is you and I and all of us here are fighting, and yet we've got a corrupt court system. So I'm asking you, you've got all this information. It's very valuable information. You've done a lot of really good hard work.
Yeah.
What the hell do you do with it? Where do you take it? What are you, I'm
Well,
asking
it-
you specifically what you're going to do with that, Lex, to make sure that these people are held accountable. Who are you going to give
Tell
this
you what, I'm
information
going to give
to?
you my answer.
Okay.
Someone else picks it up. I've done my part,
Yeah, I think the question is, what are we gonna do with this?
right?
And I think
Like
the group,
I've done enough. Like someone else picks it up. Now, here's what I'm going to say. There's good news. Here's the good news. I want to talk about the flu shot and what I'm seeing from the BCCDC. The BCCDC compiles statistics on the annual flu immunization of healthcare workers. They, by the nurses, the doctors, clerical staff, management, who takes the flu shot every year. Here's the good news, very good news. Between 2013 and 2019, the uptake of the flu shot in British Columbia amongst like all healthcare workers and healthcare staff was between 75 to 78%. Wow, right? Here's what happened with COVID. In 2024, that rate has cratered to 40%. It means that healthcare workers as a group have woken up. They are rejecting vaccination. The even better news is doctors specifically. You see, between 2013 and 2019, about 50% of physicians reported taking the flu shot every year. Now, at the end of 2024, it's about 17% doctors, right?
wow,
So
wow.
doctors, so you have a change, like from 50% to 17% are now taking the flu shot. It means there's a drop of 66% of doctors in the confidence of the flu shot. So it means that the immunization agenda in general is not supported by healthcare workers en masse. It's rejected massively.
And
That's
that's the part of the culture shift that we need in order to make a
that's good
change.
news,
Yeah.
right?
Lex, you've done fabulous work. This is detective work that, our law enforcement should be doing. And at some point, I got to believe that all of the work you've done is going to make a difference, both in changing the culture and in holding people to account. So I just want to thank you for what you've done.